Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text, and then proceed to the next page when you are ready. The title of the research study is XA565 as Adjuvant Therapy for Major Depression. The principal investigator is Dr. Christopher, and the sponsor is Zancorp. Why am I being invited to take part in a research study? You are being asked to participate because you have been diagnosed with symptoms of major depression that have not yet resolved with the use of standard treatments alone. What should I know about this research study? Your participation is entirely voluntary. You don't have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the health care you receive. You'll be told about any new information or changes in the study that could affect your willingness to continue participation. You can ask all the questions you want before deciding if you want to be in this study. Why are we doing this research study? The purpose of this study is to test a new medication called XA565. We want to find out what effects, good or bad, it has on people with major depression, and compare these effects to a similar medication called Tambercine. Neither XA565 nor Tambercine are meant to replace any current treatment for your condition. These medications are meant to be added to standard antidepressants used to treat depression. Almost half of patients with major depression are not fully treated with standard antidepressants alone. Both XA565 and Tambercine have been shown to have antidepressant properties that work in a different way than traditional antidepressant drugs, and to have immediate but short-term effects in relieving symptoms of depression. Thus, patients may get immediate relief while waiting for their standard antidepressant medication to begin working. However, XA565 has been altered somewhat so that it may have fewer and less serious side effects than Tambercine. It's thought that adding XA565 over several weeks may have more lasting effects on symptoms of depression, more quickly than antidepressants alone, with fewer side effects than Tambercine. Zancorp is the company that created and makes the experimental medication XA565 and other medications. XA565 has not been approved for this use by the U.S. Food and Drug Administration, FDA. XA565 has been used in animals, in healthy people, and in single doses with patients with major depression. Tambercine is approved by the FDA for treating major depression and is sometimes used in addition to standard antidepressants for treatment-resistant depression. How long will the research last? We expect that you'll be in this study for 12 weeks, requiring 7 outpatient visits. How many people will be studied? We expect about 50 people will be in this study at this site out of 500 people in the entire study nationally. Will I definitely receive the experimental medication? No. The decision to give you XA565, the experimental medication, or Tambercine will be made by chance, like flipping a coin. You'll have a 50-50 chance of being given XA565 or Tambercine. Neither you nor the study doctor will know which study medication you are getting. In an emergency, a doctor can find out what you are taking by calling the on-call investigational pharmacist. What happens if I say, yes, I want to be in this research? You'll have the following tests to see if you meet the requirements for being in the research study. If you had had some of them recently, they may not need to be repeated. This is up to the study doctor. Prior to beginning of the study, health review. We'll ask about your general medical health and mental health history, your current depression symptoms, and your medication use history. Demographic history. We'll ask about the ethnic background of you and your parents. Vital signs. We'll check your weight, height, blood pressure, and pulse. Pregnancy test. If you're a woman and can have children, you'll have a blood sample drawn to be tested to see if you're pregnant. If you're pregnant, you may not take part in this study. You'll have to be using a highly effective form of birth control to be in the study. If you meet study criteria, you'll be randomized into one of the study groups. What happens during the study? You'll be asked to come for a study appointment at weeks 1, 2, 3, 4, 5, and 6. At visits 1 through 5, you'll be given an infusion of the study medication you were randomized to take. An infusion is a mixture of medication and a sterile fluid that is given through an IV line into a vein in your arm. The visit will last about 1 hour, with the infusion lasting about 30 minutes. At weeks 2, 4, 6, and 12, you'll be asked questions about your symptoms and daily activities. Researchers will complete standardized measures of depression symptoms and use these scores and your reports about yourself to see if your symptoms are improving. You'll be asked about any side effects you've experienced. What happens after the study? When you finish the study medication, you'll come in for a follow-up visit. If you permanently discontinue treatment prior to the end of the study, then research staff will follow up with you by telephone 1 week after you discontinue to see how you're doing. The telephone contact will take about 15 minutes. After the entire study is finished, all the people taking part have finished the study, and all the effects of XA565, both good and bad, have been compared to tambourine, we could tell you which study medication you took if you desire to know. Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the trial. The top row lists all of the times you'll be contacted while in the study. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it, and then advance when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of XA565, which have been most commonly reported: nausea and vomiting, blurred vision, dizziness, increased heart rate during the infusion, and increased blood pressure. These side effects are temporary and will wear off later in the day following your infusion. You shouldn't drive on the day of your infusion, but you can drive the following day. Risks of the approved medications include the following side effects of tambourine, which have been most commonly reported: vivid dreams and nightmares, nausea and vomiting, blurred vision, dizziness, out-of-body experience during the infusion, increased heart rate during the infusion, disrupted or slowed body movements, and increased blood pressure. There are other potential risks of participating in the study. The most common risks of inserting an IV line into a vein and receiving medication by infusion are inflammation of the vein and leaking of IV fluid into the area surrounding the vein. If the IV leaks, it'll need to be removed and restarted in a different location. Risks that are possible but unlikely include infection, nerve damage, and puncturing an artery instead of a vein. Risks associated with drawing your blood, for a pregnancy test when applicable, include redness, swelling, pain or discomfort, and bruising at the site of the needle stick. Some people may experience dizziness, lightheadedness, and/or fainting. Answering questions about your symptoms could make you feel uncomfortable or distressed. Your IV will be inserted by a doctor or nurse highly experienced in performing this procedure. Your condition will be watched closely during the study. If you have any serious reactions or problems, the treatment will be changed or stopped to protect your health. What are my responsibilities if I take part in this research? If you take part in the research, it's important for your safety that you follow the directions of the study doctor and research staff, tell your study doctor and staff about all medications you are taking now, including prescription and over-the-counter medication, and any new medications that are prescribed to you, and do not use illegal drugs or incorrectly used prescription medications. Will being in this study help me in any way? You may not benefit directly from being in this research study if you are assigned to take the experimental medication and it doesn't prove to be effective. It's hoped that the XA565 may improve symptoms of depression more quickly and with fewer side effects than tambourine, but we cannot promise that this will happen. However, the results of the study may help others in the future. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medicines, clinic visits, and tests that are done for research purposes will be free. Any costs for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We cannot promise complete privacy. The University of Massachusetts Medical School Institutional Review Board, i.e. the committee that reviews, approves, and monitors research on human subjects, and other representatives of UMass may need to review your records. As a result, they may see your name, but they are required not to reveal your identity to others. The study sponsor, Zancorp, and/or their representatives, and the U.S. Food and Drug Administration, FDA, may inspect your medical records that pertain to this research study. Your identity will remain confidential in any study results that are made public. What happens if I'm injured because I took part in this research? If you're injured while in the study, seek treatment and contact the study doctor as soon as you're able. If you're injured or have any harmful effects as a direct result of the administration of XA565 or Tambrosine, or any procedure required by the research, necessary medical treatment will be made available to you at the UMass Memorial Medical Center. The sponsor, Zancorp, will pay the reasonable and necessary medical costs for study-related injury that isn't eligible for billing to your medical insurance. To pay these medical expenses for a research injury, the sponsor will need certain information about you, such as your name, date of birth, and Social Security number. This is because the sponsor has to check to see if you receive Medicare. If you do, the sponsor must report the payment it makes to Medicare. The sponsor cannot use your information for any other purpose. The sponsor has no plans to pay for medical expenses for injuries that are not directly related to your research participation or that are caused by a natural course of your disease. The sponsor has no funds set aside for any other form of compensation in the event of a research injury. You do not give up any of your legal rights by agreeing to enroll in this study. Will I be given any money or other compensation for being in this study? You'll be reimbursed for your time, travel, and other expenses associated with this research study. You'll be paid $50 at each clinic visit. If you complete all study procedures, you'll be reimbursed a total of $350. In order for us to pay you, you may need to give us private information like your home address or Social Security number. If you receive more than $600 in a calendar year from being in research studies at UMass Worcester may report this to the IRS and send you a 1099 form for tax purposes. In addition, free parking for all scheduled visits will be provided to you during the study. Zancorp will be the owner of the study data. Zancorp plans to use the results and may get patents or sell the medication in the future or make profits in other ways. You won't be paid for any part of this. What are my other options? You don't have to be in this study. Instead of being in this research, you may continue to get regular care from your doctor, which may include being prescribed the FDA-approved medication in this study. If you decide not to be in the research now or later, it won't affect your usual care and it won't be held against you. Talk with your doctor about your choices. What happens if I say yes, but I change my mind later? You're free to leave the study at any time. There are no penalties, and you don't lose any benefits to which you're otherwise already entitled. We'll ask to call you on the telephone to collect information about your symptoms and side effects. If you leave the study and don't agree to provide more information, then no more information about you will be collected. Data that we have already will stay in the study database and cannot be removed to maintain the integrity of the research. However, you can ask us to destroy any information that identifies you so that no one knows that the data came from you. Our contact information is below. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you do not want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, you need treatment not allowed in this study, you fail to keep your appointments or take the medications as instructed, you become pregnant, or the study is canceled by the company making the medication, Xancorp, the FDA, or the UMass Institutional Review Board. Who can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.